permanent brow drop from temple filler. Recently, I came across an awful injury that a patient suffered from a temple revolumization procedure. This procedure was done with a cannula, and the patient suffered immediate brow asymmetry that we thought would recover, but unfortunately just persisted. Now, several months in, the patient still does not have movement on one side. So how could this happen? I think there's a lot to unpack with how cannulas can potentially affect patients when used in the temple region, and we can compare and contrast this with what might happen, or the likelihood of what might happen, using the so-called gunshot technique. So let's think about the anatomy of the frontal branch of the facial nerve. So this nerve emerges from underneath your zygoma. It passes through the masseter muscle, comes up through on top of the fascia of the muscle, and then makes its way up into the temple. Now, when it makes its way into the temple, it is coming up through the layers, and it eventually will pass into where many people will place a cannula to revolumize. And this is why it's actually quite common to have some effect on the nerve, but it's usually temporary. So the facial nerve is even sometimes injured on purpose. There was a treatment coined Frotox many years ago, which involved freezing that area. So you can actually cool the nerve down by placing a probe into this area for long enough that you actually cause a neuropraxia, which means the nerve no longer causes the frontalis muscle to contract, and you get an improvement in lines and wrinkles in exactly the same way as you might with a botulinum toxin treatment. If you do the cannula technique in temples, you'll be relieved to find that in most cases, if you get brow heaviness, it's actually quite common and it is temporary, and it's simply an effect of the lidocaine. So in the space between the deep and the superficial fascia where the nerve resides is exactly where the lidocaine is spreading out and affecting the nerve. And this actually happens in a large proportion of treatments. So it is quite common, unless you tell your patient, for them to suddenly spot their eyebrows aren't moving as much. And this causes a lot of concern and anxiety if you haven't warned your patient. Now, the good news is most of the time, this will simply wear off in a matter of hours. In some cases, it can be as long as 8 hours after the procedure before this fully wears off. But in other cases, like this case I recently came across, something else has happened to cause a much longer effect. So in most cases, this is temporary because the lidocaine eventually wears off. All that lidocaine does is block the sodium channels on the nerves, which means the impulse simply doesn't get through. As soon as the lidocaine disperses, you get activity back in the muscle. Now, there's another type of neuropraxia that can be caused when the cannula damages the nerve itself. So if you're unlucky enough to prod or pull or compress a nerve, you can temporarily stop that nerve from working. Now, this first type of injury is exactly the same thing as you may have experienced if you spend too long on your phone on the toilet, where you compress the nerve in your leg and end up causing a dead leg, which then gets pins and needles when you move on. So the same thing can happen with nerves in the face. A compression affects its function, which causes a temporary decrease in nerve activity, or a neuropraxia. And this is probably the most common type of nerve injury that you see after dermal fillers, particularly with cannulas. And although it's not that common, you can usually reassure your patient. One of the key things I always look for in these cases is how long did it take for that weakness to occur. If the muscle weakness occurred immediately during the procedure rather than a few minutes or hours after the procedure, it's more likely an injury to the nerve that's more severe than if it came on slowly. If you think about how neuropraxias generally work, it takes a bit of time compressing the nerve before you get the outcome. So a compressed nerve is less bad than a severed nerve, and a severed nerve would give you a more immediate change in the muscle activity in that area. Now, of course, continuous compression can still cause a long-lasting neuropraxia, and this is another issue to be aware of. If you were to cause compression and not release that compression, you can cause a much more long-lasting injury. And trying to separate these two out is impossible without allowing time to pass through. But the most common cause is the lidocaine, followed by compression that's temporary, sometimes by the swelling of the procedure, and then rarest of all would be a complete severing of the nerve that is essentially permanent. So recently, anecdotally, I've noticed a significant uptick in complications from temples. And of course, we never know without doing proper studies whether this is just random or whether it's to do with more people doing the procedures. But I'm quite interested in the differences between these two different techniques. I know there are certain schools of thought that think, for example, the gunshot technique is particularly dangerous, and they will use cannula for everything and feel very nervous at the thought of doing the gunshot technique. whereas there are also people on the other side of the fence who feel the same way about cannulas. Now, in my experience and in my clinic in skin beaver and skin beaver training, we use both techniques. And I have seen now 3 different complications caused by a cannula, one of which was compression of the vein in that area, which caused a swelling and protruding veins, which ended up with the clinician having to reverse the procedure. That was done with a cannula. I've also seen 2 vascular occlusions of the superficial temple artery with clinicians using the cannula technique. And I've yet to see any complications from injecting with the gunshot technique. Now, I clearly do not have a large enough sample, but I'm very interested if there's anyone out there who has seen complications from either technique. I'd really appreciate it if you would inbox me on Instagram so that we can learn more about what actually plays out. So let's talk more about why this long-lasting weakness of the face could have occurred after a cannula treatment. Now, when you see cannula treatments done, it's quite clear that you cover a much larger area with your instrument than you do, for example, with the gunshot technique. So moving a large instrument in and out of that layer, you're much more likely to get involved with the nerve and to poke or prod, or potentially, if you're relatively rough, you might even tear or break a nerve. So these are the 2 types of injuries which I'm most worried about, because if you cause compression of the nerve, at least that's relatively temporary and it might get better within weeks. But if you tear or twang the nerve to such a degree that it's damaged more severely, this is called axonotmesis, then you may have at least months, but probably a permanent injury. And I think the crucial factor here is these large instruments, which we believe are safer in terms of avoiding blood vessels, being put into different parts of the area relatively roughly in different people's hands, or just through bad luck, you can end up with a more significant injury to these very tiny nerves in that area. So what would I do to avoid it? Assuming I was going to use a cannula technique, like I always say, the analog variables are the hardest ones to measure, because how do we measure gentle versus rough? It's very, very subjective, and no one's really able to put a number on that. But I do think if you inject as if you're almost like you're diffusing a bomb, tiny, smooth movements, and if you get any resistance, stop and try and find an easier path through, and you're very gentle with it. And once you've opened up the area with a little bit of filler so that the cannula slides more easily, then you can pass in and out without putting any pressure on additional structures. So for me, that's the main thing that will allow fewer patients to suffer negative side effects, is just being extra gentle when you're using a cannula in this area. If you'd like to learn much more about the anatomy and develop real confidence with where these structures lie and how to inject and how to make your own decisions without learning just by copying other people, then make sure you sign up in the link below to something very exciting I've got coming soon.